When you were younger, you had a full head of hair, thick, shiny, easy to style, never something you had to think about. It was just there, part of you, and somewhere along the way, that started to change. Maybe it thinned out. Maybe it lost its shine. Maybe you started noticing more hair in the brush than you used to, or more scalp showing in photos than you remember from just a few years ago. If that's you, I want to ask you two questions today. What's actually causing it, and is there any real hope? But I also want to ask a third question that almost nobody addresses. How do you deal with what this does to you emotionally? Because I've had more patients cry in my office over their hair than you'd ever expect, and I don't think that gets talked about nearly enough. I'm Dr. Rose Hart, and today we're covering all three S's, the real science, what genuinely helps, and just as important, how to carry this without it quietly chipping away at how you feel about yourself. Drop a comment with your age and what you've noticed changing, thinning, dryness, texture, shedding, and subscribe because I break down real science like this every week for people who want to feel strong after 60. Let's start with what's actually happening biologically. Most people are told the same thing. It's just aging, nothing you can do. I hear that from patients constantly, and in most cases, it's incomplete. Hair thinning after 60 is often your body waving a flag about something fixable, and almost nobody explains what that flag actually means. Hair follicles are some of the most metabolically active tissue in your entire body. They need a constant supply of protein, iron, oxygen, and specific vitamins just to keep producing healthy strands. When any one of those supplies drops, the follicle does something predictable. It shortens its growth cycle and pushes out weaker, thinner hair to conserve resources. Your body isn't malfunctioning, it's rationing. Here's what most people never get told. Thinning hair after 60 is frequently linked to nutrient gaps that are common, testable, and correctable, not some unstoppable countdown clock. Cause 1, iron deficiency. This is the one I catch most often in my clinic, and it's wildly underdiagnosed in women over 60. Iron is essential for carrying oxygen to the hair follicle, and low iron, even mild borderline low, not full-blown anemia, has been repeatedly linked in research to increased hair shedding. The frustrating part is that standard checkups often don't flag it unless levels are severely low, so a lot of women walk around with follicle-starving iron levels for years and are simply told it's genetics. I had a patient, Diane, 66, who'd watched her ponytail get visibly thinner over 3 years. Her doctor told her it was menopause-related and left it there. When we checked her ferritin, the stored iron marker, not just basic hemoglobin, it was low. We corrected it under medical supervision, and over the following months, her shedding slowed considerably. Nothing dramatic or mysterious, just a gap that had been missed. Cause 2, protein intake quietly dropping. Hair is almost entirely made of a protein called keratin, and as people age, appetite naturally drops and protein intake often falls with it, sometimes without anyone noticing. Your body prioritizes protein for muscles and organs first. Hair is one of the first places it gets rationed from when supply gets tight. This is one of the most common and most fixable causes of thinning I see, and it rarely gets mentioned because it sounds too simple to be the answer. Cause 3. Thyroid function. Thyroid issues become significantly more common after 60, and both an underactive and an overactive thyroid can cause noticeable hair thinning, often before other classic symptoms show up. This is genuinely important. If your hair loss is thyroid-driven, no amount of vitamins or oils will fix it until the thyroid itself is treated. A simple blood test settles this, and it's one of the first things worth ruling out rather than guessing around. Cause 4, chronic stress and cortisol. There's a well-documented phenomenon called telogen effluvium, where a stressful event, physical illness, surgery, grief, a major life change, pushes a large number of follicles into a resting phase at once. Around 2 to 3 months later, a wave of noticeable shedding follows. This is temporary and usually self-corrects, but it explains why so many people notice sudden thinning that seems to come out of nowhere a few months after a hard period in life. And this matters more than people realize, because the stress of worrying about hair loss can itself become part of the cycle keeping it going. If this is useful so far, Hit like SAR, it genuinely helps this reach more people who need it. Cause 5. Vitamin D and B12 status. Both tend to decline with age, both are involved in follicle health, and both are simple to test for with a basic blood panel. Deficiency in either has been associated with hair thinning in multiple studies, and correcting a genuine deficiency, under your doctor's guidance, is one of the most reliably helpful steps available. Now, here's the part I actually want you to walk away with, because information without action is just anxiety. 1. Get real blood work, not a guess. Ask specifically for ferritin, stored iron, a full thyroid panel, not just TSH, vitamin D, and B12. This single step identifies the fixable causes faster than any product on a shelf. 2. Prioritize protein at every meal. Eggs, fish, poultry, legumes, Greek yogurt. Hair is protein. Feed it like one. 3. Don't fear healthy fats. Omega-3s from fatty fish or walnuts support scalp health and have been linked to reduced shedding in some studies. 4. Be gentle mechanically. Tight hairstyles, aggressive brushing, and high heat styling all cause real, measurable breakage that gets mistaken for thinning. 5. Manage stress where you can. Sleep, movement, and connection aren't just quality of life factors, they directly influence the hormonal environment your follicles are living in. 6. Give it time. Hair grows in cycles measured in months, not days. Real improvement from correcting a deficiency typically shows up over 3 to 6 months, not 3 to 6 days. I had a patient, Helen, 71, who came in convinced her hair loss was just genetics, nothing to be done. Blood work told a different story: low ferritin and borderline low B12. We corrected both under medical supervision. She adjusted her diet to include more protein at breakfast, and over the following several months, her hair texture and density noticeably improved. Not a miracle, just her body finally getting what it had been missing. I want to be honest with you about something important. Not all hair thinning is reversible, and anyone promising you it definitely will be is not being straight with you. Genetic pattern thinning, for instance, responds to different treatments than nutrient deficiency thinning, and telling them apart matters. But a huge percentage of the thinning I see in my own clinic traces back to something correctable, and most people were simply never told to check. Now let's talk about the part almost nobody addresses: what this actually does to you emotionally. I want to say something clearly because I don't think it gets said enough in a doctor's office. It is completely reasonable to feel something about your hair changing. Hair isn't just tissue. It's tied to identity, to how you recognize yourself in the mirror, to decades of memories of who you were in every photo, every mirror, every good hair day you didn't think twice about at the time. When it changes, it's normal to feel a sense of loss, even grief, even if it feels silly to admit out loud. I've had patients tell me they feel like they're disappearing a little, like the world starts treating them differently once their hair signals older before they feel ready for that label. That feeling is real, and it deserves to be taken seriously, not dismissed with, "it's just hair," or "everyone goes through it." Here's what I want you to understand, though. Thinning or changing hair is not a reflection of your worth, your vitality, or how much life you have left to live well. It's a biological signal, sometimes one you can influence, sometimes one you can't fully control, and neither outcome says anything about who you are. A few things that genuinely help with the emotional side, not just the biological one. Separate the grief from the shame. It's okay to miss how your hair used to look. That's grief, and grief deserves space. But shame, the quiet belief that something is wrong with you for aging, is a story worth questioning every time it shows up. Aging is not a personal failing. It's the price of a long life, and a long life is something worth having. Talk about it out loud. So many of my patients carry this silently, assuming they're the only one who feels this way about their hair. They're not. Nearly everyone over 60 has some version of this feeling, and saying it out loud, to a friend, a partner, even in the comments below, tends to shrink its power almost immediately. Separate what you can influence from what you can't. Getting blood work done and correcting a real deficiency is something within your control, and taking that action itself tends to ease anxiety, regardless of the outcome. But if some thinning is simply genetic or age-related and doesn't fully respond to correction, that's not a failure on your part. It's biology doing what biology does, and it doesn't require your permission or your shame. Consider what actually makes you feel like yourself. For some women, that's a new haircut that works with thinner hair instead of against it. For some, it's a wig or topper they genuinely enjoy wearing, not out of hiding, but out of style. For others, it's simply deciding to stop apologizing for gray or thinning hair in photos. None of these choices is more correct than another. The only wrong answer is one made entirely out of shame instead of preference. And here's something worth sitting with. Some of the most striking, confident people I know over 60 aren't the ones with the thickest hair. They're the ones who stop treating their hair as a referendum on their worth. That shift in relationship to your own reflection tends to matter more than any single strand. If you've been handed the "it's just age, nothing to do" line and it never sat right with you, trust that instinct. Ask for the blood work. Ask specifically for ferritin, not just a standard iron panel. Ask for a full thyroid workup, not just TSH. These are reasonable, normal requests, and a good doctor will support them. And if the answer comes back that this is simply part of your biology, genetics doing what genetics does, that's not a life sentence on how you feel about yourself either. You get to decide what your hair means to you. Nobody else does. Before you go, comment your age and what you've noticed with your own hair, and if you're comfortable sharing, how it's made you feel. Have you ever been told it was just genetics and wondered if that was the whole story? Have you ever felt like your hair changing made you feel less like yourself? I read every comment, and I promise you, you are not the only one who feels this way. And if this helped you see your own hair differently, biologically or emotionally, send it to someone who's been quietly struggling with this, a friend, a sister, a neighbor who's never said it out loud, but who you can tell is carrying it. This might be exactly what gets them the right test instead of another bottle of vitamins that was never going to help, or exactly the reminder they need that their worth was never sitting on top of their head to begin with. Thanks for watching. Subscribe for more science-backed strategies for feeling strong after 60 chow inside and out. Your body isn't broken, and neither are you. Once you know what to look for, both the biology and the feelings around it are something you can actually work with. I'm Dr. Rose Hart. Stay strong, stay healthy. I'll see you in the next one.